masticate. It's a verb. It means to chew, to bite and grind with your teeth. And it is the #1 coping skill used in chewing gum, which is recommended by many people helping others lose weight. It's also one of the recommendations for The Biggest Loser. And when they're chewing gum, when they're masticating, it's in hopes to not eat food. But I contend there's more to this story. Let's learn more about that. To masticate, this is the act of chewing gum. And in this patient, as the gum enters their mouth, they begin to chew. And what is most important in this activity is the parotid gland, this little organ in front of your ear, found in both of your cheeks, and it is massaged or milked when you chew, even chewing gum. I think of it as like a tiny pancreas, because the enzymes that come out of your pancreas and the enzymes that come out of the parotid gland are both there to help break down the bonds in your food so that you can extract the nutrients. The other major message coming from the parotid gland is to tell the brain that something important is about to happen, and that is nutrients is about to enter the body. That brain now signals the system to say, hey, but guys, be ready. There is nutrients coming down the gullet, and we need you ready to absorb that to keep this human being alive. When I look at the act of chewing gum and this discussion about whether or not a patient should be using that coping skill when they're stalled with weight loss, it turns into a pretty hearty discussion. I've advised patients many times on losing weight, and when they come in and say, Doc, I did a great job of losing weight. I got those first 20, 30, 40 pounds off, but now I'm stalled. And if in their history I find that they are chronically chewing gum, I begin by explaining there's more to this chewing gum than you're giving it credit for. And in that process, there's been a debate in medicine whether that chewing of gum, whether that mastication is enough to sabotage their weight loss. There are several studies that have looked at this. Let's take a look at one of those. This study is recent, in 2021, and did a really good job of setting up two populations that looked very identical, and they asked them both to masticate these two this food, both the same in these two populations. The food was a rice cake, and they separated these two populations into folks that were fast chewers and slow chewers. So when we look at the slow chewers or the slow eaters, they were the ones that had this higher area under the curve. They had a higher blood glucose in their findings. And you can say that they were slow chewers and they were better masticators. They massaged their parotid gland longer and for higher amounts of time when chewing that food. This was compared to the people that were fast eaters who only chewed a few times, didn't massage their parotid gland as much, and they had a lower area under the curve when looking at average blood sugars. Once the food was consumed, they checked those blood sugars every 15 minutes for over 2 hours. And indeed, those with the longer, more stimulated parotid glands had higher blood sugars and, as a consequence, higher insulin response. Now, although that study shows very clearly that, hey, we have a significant difference in these two identical populations of insulin response and blood glucose response, I contend that doesn't completely answer the question for the people coming into my clinic. Because when you look closely at the folks in this study, first of all, I like to point out that their age was on average about 26 or 27 years old. Second, they had a body mass index of 21. That's pretty lean. They had a body fat percentage of about 14%. And this was the case in both groups, both the fast eaters and the slow eaters. Now, if you're not familiar with body fat percentage, let me just give you an example of my son. He's a wrestler. He checks in every week with his coach by weighing in, and his mother made him do a body fat percentage check through a DEXA scan before the season started. And in this image right here, his body fat percentage was 14%. So it says it is his image that this study was done on. And in comparison, my body fat percentage is probably 10 or 12 or maybe even 15% higher than his. And the patients that are coming in to ask for help, they have even more body fat percentage. And it's because of that difference in the demographics that I point out. When the patients who are trying to lose weight come in and they say, "Doc, I had this great result with your ketogenic diet. I dropped my carbohydrates to 20. I lost 20, 30, 40 pounds, and now I'm stalled." And if in their history I find that they are gum chewers, they chronically masticate, I point out that they are doing something very, very sabotaging of their success. And that has to do with this little parotid gland. So in their defense, as they're trying to cope with not eating anymore, they are stimulating their insulin to secrete at a much higher level than they know. That parotid gland sent the message to their brain, and their brain prepared for food to be coming in. Unfortunately, that is after 2-3 decades of excessively producing insulin. And in that case, that insulin will dictate that every fat cell will be locked down. I don't care if you're chewing gum or if you're coping with those skills to not eat, insulin wins. Insulin will keep their resources of fat and energy locked away, and it is done in a very robust way for my overweight, insulin-resistant patients. So what's my recommendation? If patients are gum chewers, there's 2 things I recommend. Number 1, we work on their eating window, which means first bite of the day to last bite of the day. I want that at least kept within 8 hours, and all masticating, all gum chewing must go within those 8 hours. We slowly work on reducing that, but that's not the hardest thing for these patients. The hardest problem for these patients is recommendation number 2, which is to work on their coping skills to comfort themselves. They've been using food to comfort themselves long before they met me. That's how the weight got on. It was the way they soothed. It was the way they comforted themselves. And by using gum, they substituted this coping skill of gum chewing, even sugar-free gum chewing, to feel better, to offset the craving, to be able to deal with no food coming in. And although it is not they are not consuming food, what they are doing is they're priming that endocrine signal that goes to their body to hold on to those calories and not be able to lose weight. So teaching somebody to cope with the uncomfortableness, the anxiety, the cravings, the disappointment, the loneliness is not easy. There's a really great hack that I use to help them begin. If you want to know what that is, check out this video. It's short, but great.